Hello, today we're going to talk about a day in the life with spinal cord injury. Please take a moment to pause and read this disclaimer. In this video, we'll be going over what typical needs there are during the day, as well as needs during the night for different cares, physical assistance recommendations, caregiver support resources, transportation options, the importance of participation in meaningful activities and planning for that, as well as the continuum of care. We know this is just the beginning of the journey, and so I want you to know what to expect as you continue on your recovery. As far as daytime cares, first we'll talk about skin care. A skin inspection is recommended twice daily. We recommend typically morning and night, and depending on your mobility, you may be able to do this yourself using a long-handled mirror, as is pictured here. You may need to identify who you'd feel comfortable doing the skin check for you if you're unable to do it yourself. When you are up and out of bed, if you're in a power chair or manual chair, pressure reliefs still need to happen every 20 minutes for 2 minutes. In this picture, you can see a power chair in the full tilt position, which is really important for keeping that skin healthy. In a manual chair, it can look a little bit different. There are several options, and make sure that you've talked to your physical or occupational therapist to ensure that you know how to effectively complete pressure reliefs independently. Bladder care during the day will typically occur every 4 to 6 hours if you're using intermittent catheters. If you have an indwelling catheter, such as a suprapubic or a Foley, that would still need to be emptied at least every 6 hours, or if that bag is at least 75% full. Consider fluid balancing throughout the day to help be consistent with your bladder management needs, and ensure that you have access to water. Work with occupational therapy to make sure that you can independently, if you're able to drink, access your water throughout the day. One helper might be needed for this depending on your mobility. For bowel care, typically it needs to happen the same time every day. And in some cases it can be every other day, but we recommend same time every day, especially initially after injury. Bowel care can take anywhere from 20 to 30 minutes up to an hour and a half if in conjunction with a shower. We never want the actual bowel care to be lasting more than an hour. If it is, you'd want to refer to our bowel video and reasons to contact the doctor to see what can be adjusted to make that better. Depending on your mobility, you may be able to complete bowel care on your own or need the assistance of one person. And the timing is really important, so making sure that the time that's going to work well for you at home is being established while you're at the hospital if possible. We will try as a staff to make sure that you're at the preferred time at least 2 weeks prior to discharge. However, this is optional. Respiratory care for those who it's applicable for, cough assist needs during the day, suctioning needs during the day, respiratory treatments during the day, and then overnight cares. Turning while in the hospital, the recommendation is every 2 hours. If there's a wound present, the recommendation continues even at home as every 2 hours. But when your skin is healthy, you are able to start to push that a little bit up to every 3 or 4 hours, but going back to every 2 hours if you start to see an area of concern on your skin. And then depending on your fluid balancing and your body, you may be able to go through the night without having to wake up to empty the bladder. However, you don't want to go more than 6 hours, so keep in mind trying to empty right before bed, and then ideally first thing when you wake up. And as long as you're not leaking, that can be an option for some people, which can help with sleep quality. Additional considerations. So I mentioned before the timing of bowel care, making sure that works into your life depending on what you're getting back to, what your routine is, who's available to help you, and what time of day they're able to come. Medications, thinking about what medications you're on, when they're due, and if you are able to get them yourself or somebody needs to assist you with those medications. If you have respiratory cares involved, making sure that you have a schedule for those. Meeting your bladder needs. Some people can be really routine about their bladder needs and have a set schedule. Other people, depending on their drinking habits, may need to be a little bit more fluid with how frequently they're emptying their bladder based on what they're drinking. Supervision recommendations. This will come from the doctors as well as the therapist as far as what amount of physical supervision is needed or for safety. So for many people, with the use of smart room technology and voice control, if that's applicable, they're able to be alone and be able to call for help. The big things are being able to enter and exit your living space independently and being able to call for help. And those are some really big key factors into being able to be alone for longer periods during the day or night. And then preventing autonomic dysreflexia. If you aren't sure what I'm talking about, make sure that you visit our autonomic dysreflexia videos part 1 and part 2 if you have an injury at the T6 level or above. For physical assistance, it really does vary depending on how much you're able to transfer yourself physically, how much assistance you need from others, if you're using a portable Hoyer lift at home or not. And so if you are, depending on your size, you may need 1 or 2 people to help with that portable Hoyer lift transfer. Consider the flooring that you have where you're going to have your bed and your chair so that portable Hoyer can be moved as easily and as smoothly as possible. Having people available to help with repositioning for things such as turning, or if you need assistance repositioning in your wheelchair, and then getting out of bed for things like bowel care and shower as well. If a ventilator is involved, consider increasing the number of people that you have trained and available to assist you. For caregiver support, we really want to make sure that caregivers are taking care of themselves. Setting up a caregiver rotation is something that our rehab psychologists are wonderful at helping with, a plan for caregivers to actually take little breaks and make sure they're taking care of themselves to avoid burnout. Caregiver training, while here in inpatient rehab, all those daily cares will be happening that we've gone over, both day and night cares. In education, we'll be talking about prevention of medical complications, and then we'll learn how to treat those medical complications if they do arise for some things like autonomic dysreflexia or OH, the low blood pressure, which stands for orthostatic hypotension. We also have caregiver support resources such as our outpatient support group here locally. We all have peer health coaching programs, which are intended primarily for individuals who have the spinal cord injury, but we do have some significant others that are also willing to be a mentor or a coach for those individuals. Please take a second to scan our QR code if you're interested in more resources for caregiver support off our community resource library. For transportation, if you're using a power wheelchair does not go in a typical vehicle, and so an accessible van would be needed. Not everyone can afford that, so then looking into alternative options such as public transportation or paratransit if that's available in your area. There is non-emergent medical transportation as an option as well for if you need that to get to and from appointments. There are some places that provide accessible taxis as well as accessible van rentals. And please talk to us rehab educators or to your social worker for additional resources on transportation. And lastly, private transport companies that will take people beyond just medical appointments, but that is an additional cost. For participation in activity, we cannot say enough good things about how important it is to be engaged and have things to look forward to. We know that people's recoveries are better when they are participating, and it improves their mood, their quality of life. And so with this, technology can be a huge part of, using voice control or using different assistive technology to interact with others, interact with your environment, be able to engage and call people and watch things and have some control. Accessing resources such as our Trails program, which primarily focuses on adaptive recreation. There's things such as libraries in your area that have a wide range of resources, things like audiobooks and movies and magazines you can access all through a smartphone if you have one. Social plans, I mentioned the importance of social engagement, things to look forward to, making plans with others. With that, planning the supplies you'll need when you're out and about in the community, having your bladder supplies, having a blood pressure cuff, and kind of thinking through, what would I need while I'm out? So as far as training goals while you're in rehab with us, our number one goal is that you as the patient are able to direct your care as best as you can and participate in as much as you're able to do as independently as possible. Therapy provides that hands-on training to the patient as well as to the family or caregiver. Rehab education, we provide education on your diagnosis and how to ideally reduce and prevent the risk of complications at home with preventing things like urinary tract infections. Nursing will provide additional education and hands-on training for things like bladder, bowel care, skin turns. Psychology is an important part for the emotional support for everyone involved. This is a huge change, and so there's a lot of adjustment that needs to happen, and we want to make sure that you feel supported in that way. And then the doctors, last but not least, they are overseeing all the medical care, so adjusting medications as is needed and overseeing that you're health and your care is optimal for your recovery. The continuum of care, the discussion from here would be to discuss if you're wanting to go home with home health therapy versus outpatient therapy, and understanding that you cannot do both at the same time. And so what's available with each, what works better, what's in your area, what transportation you have involved. So that's a discussion to have with your case manager and your therapist and the doctors to really determine what's going to be best for you and your family. Oftentimes, people will initially go home with home health therapy, and then if they are able to and have transportation, then they will often transition to more of an outpatient therapy setting, as that generally has more interventions that can help with spinal cord recovery. Home health can be wonderful though, because you're working in your home environment, getting things dialed in with things like your bathroom access, being able to practice getting around in the home can be really helpful. So they both have their pros and cons. Follow-up medical appointments will be set up prior to you discharging. And if you're not following with our outpatient clinic, it's very important that you discuss with the doctors and your case manager about who is going to be overseeing your medical care following discharge related to your spinal cord injury. Our case manager will also provide support resources and answer questions regarding what your insurance will and will not cover, and practice using MyChart before discharging. This is really a great way to communicate with your healthcare team and ask questions and get resources. So make sure that if you're interested in using that you practice it before you leave. The key takeaways are the importance of planning. We can't emphasize this enough, that it's going to take some routine and some planning involved to make sure that you're prepared for discharge. We're here to help you feel prepared. So utilize your team around you. We all want what's best for you, and we want to help support you and your family as much as we possibly can. This is just the beginning of your recovery journey. This is a lot to take in, but hopefully this is a good overview of what to expect looking forward. Thank you so much for watching. If you have any questions, please pass them along to anyone on your healthcare team, and references are available upon request. Thank you. Have a wonderful day.